Well, of course, we've heard a lot from state leaders, including Governor Lamont, about how the state is handling with this crisis. We do want to check in on different cities and towns, too, to see how they're doing and to see what leadership is doing. So to that end, thank you so much to Mayor Neil O'Leary from Waterbury joining me on the phone this morning. Mayor, I guess at last check, 30 people in your city of about 100,000 or so have tested positive, but we were just talking right before we went on the air. You feel like your city is doing a pretty good job adhering to social distancing, huh?
I do, Tim. But as a matter of fact, just in the last 10 seconds, I just got the report from overnight. We're actually up to 41 confirmed cases now, so we jumped up quite a bit overnight. But yes, I mean, to the social distance, I've been keeping an eye, and our staff has been keeping an eye on the parks and the streets. And, you know, I'll tell you, I'm really pleasantly surprised. This week's been a great week for that. People are definitely staying indoors. Last week we saw kids out playing basketball and doing different things, and now the awareness campaign is ramped up, and I'm grateful to Governor Lamont for his leadership on this issue because it's making a difference and an impact for sure.
What have you been able to do in your capacity to help St. Mary's Hospital and to help Waterbury Hospital as they're getting ready for what could be some bad days ahead?
So we're working very closely with both of our hospitals, we've actually been able to provide them with some extra PPE equipment that we had in our police station and on our high schools for our allied health programs. We were also working with the management for the drive-through, providing assistance for the drive-through testing centers at each hospital. And, we're getting daily updates from them as to their capacity for bed space, not only in the ICU, but also in the rest of the hospital, and also working with them closely to help them in their emergency rooms as it gets ramped up. We're seeing more and more people each day looking for medical assistance, and you can feel the tension and the anxiety and the people who are coming, and especially at the testing centers, the lines are very long now.
Capacity is going to be a big factor going forward. What are you able to do to just try to help increase the number of beds, increase the number of critical care beds, and you mentioned PPE and things like that. But how much can you sort of ramp things up?
Well, we've got a couple of our park houses, if you will, where we put cots inside of them in case we need them. We've also identified other buildings in the city that we can put more cots and more availability if the hospitals have the overflow factor. The hospitals have done a great job identifying space within their individual facilities and getting them ready for the overflow as well, which is, I have to say the planning here in Waterbury started in mid-January, believe it or not, and we're proud of the fact that we seem to be ahead of the curve in a lot of ways. I'm a little bit disturbed that our positive count went up by 11 overnight, and I'm wondering where that's going to lead to over the next few days. But we're really we've got a 311 center open, Tim, where anyone can call in for any sort of assistance. It's been manned 24/7 since March 11th. We've answered over 1,200 calls, and we're doing everything from bringing groceries and pharmaceutical products to our senior citizens to also supplying food and other essentials to those who have been identified as infected, so that they don't have to go out and get groceries. And we're actually ahead of the curve so far, but we're sitting here pretty anxious as those numbers climb. We've got a number of volunteers who have assisted us in the food delivery, and we're pretty pleased with our cooperation with our local grocers, who have been absolutely incredibly generous, helping us give especially our most needy population what they need to get through these tough days.
I know you've mentioned the anxiety, and I appreciate your honesty with that. You also mentioned that you feel like the people themselves are doing a very good job with social distancing. Are you hearing anything specifically from a lot of business owners in your city, and to what extent at all can you try to help them or at least ease their minds here when they're kind of facing a no-win situation for right now?
Well, Well, here in the city, the manufacturing, of course, is the backbone of our economy. Thankfully, the governor and DECD recognize that most of that is essential business. So what they've done inside our factories here in Waterbury is they're practicing the social distance. They've changed the shifts so that there's 6-hour shifts instead of 8-hour shifts, and reduce the workforce on each of those shifts. Some of them have opened, instead of 18 hours, they're open 24 hours now. So, on that end, we're doing okay. But the restaurants, no question about it, the restaurants in the city have been hit very, very hard because of this virus, and I'm very concerned about them because they've had to lay off so many of their staff, and it's just amazing to drive by these restaurants and see them closed. The takeout service only works for some of them, quite frankly. And so, I'm very grateful to the governor and his staff at DECD for getting the information out on the bridge loans that I think are going to be absolutely necessary to carry some of these folks through over the next 12 months. I think that's going to be an absolute must, and I'm so happy the state of Connecticut stepped forth to bring that to our local business owners, because there's it's not just Waterbury. I'm sure it's the same way in every community. It's just amazing. These people all have mortgages, they have employees and insurance costs, and so this is a good step in the right direction. I'm very pleased with the state of Connecticut's efforts.
Okay, well, Mayor, I know you're very busy, so we do appreciate you taking the time, and maybe we can make this a weekly thing, because things are changing so much from week to week, and you right there sort of on the outskirts of the epicenter just want to keep an eye on those numbers and keep an eye on how you're doing, because you could be a good bellwether for the state. So